We're gonna do a quick video on the proper blood culture collection technique, and this is geared for the emergency room. If you guys don't know me, I'm Joe Sabat. I'm the Director of Critical Care, but I spent over 15 years in the emergency room and came from a facility that we brought our contamination rate from 7% to 1.5%. The national goal is 3%. We really want to get below that quite a bit, and we're going to talk about some of the things that cause us to have such a high contamination rate. And our contamination rate in this hospital has been running anywhere between 4 to 6% for the last few years. We really want to bring it below that. These are things that I have experienced, some of them that I've done myself in the past, and I've corrected myself. So, this is coming from an insider, and I just know that a lot of times we do these things because we want to get through all our patients. We have too many patients, and the problem is that those things that you're doing to save time are actually sometimes increasing the time that you're spending on doing these, or it really affects the patient's length of stay in the hospital. It increases their cost out of pocket, increases the hospital cost. So we really want to bring this contamination rate down. Number one thing you cannot do ever is draw from an existing IV or line. That will contaminate 9 out of your 10 samples that you do that from. So if you do 10 blood cultures and you take 2 of them from somebody's IV, both of those are going to be contaminated. 9 out of 10 will be. So do not draw from any existing lines or IVs. Even if your doctor asks you to. In this facility, we do not draw blood cultures from existing central lines or IVs especially. Using your IV start to draw blood cultures. So if you're starting an IV, you should not be drawing your blood cultures. This is a big one for the ER. It's a big culture change because we know how much time it takes to try to get an IV, and this patient might not have good veins. So the problem is that when you're using an IV start to get blood cultures, that catheter around the IV gelco is going to grab a bunch of skin and bacteria on its way in, no matter how much you clean it. So it's very difficult to get a sample not to be contaminated when you're drawing like that. It's not impossible, right? But you're going to have a high contamination rate. You will never come down below that 3% if we are drawing blood cultures while we're starting IVs. And I know that that's a big one for the ER, but hopefully I'll tell you some tips and some things that may alleviate the fact that you should not be doing this. The other one is not scrubbing for a full 25 seconds. Chlorhexidine, first of all, has to get down that first microscopic layer of skin to be able to get all that bacteria that's living in there. And you have to do it for a full 25 seconds for the scrubbing motion. And you have to let it dry. If you don't let it dry, chlorhexidine works by desiccation. So until the chlorhexidine is dry, your bacteria is still just swimming alive in that pool of chlorhexidine. You have to wait until it dries before you do your blood culture. Palpating your site after cleaning, that is almost 100% going to give you a contaminated sample. Even if you're wearing sterile gloves, that is not a good practice to palpate your vein. So we're going to talk about a couple of tricks, the things that I use, that we've used to not have to touch that site. Putting a sterile glove on does not guarantee you that you're going to keep that site sterile, because we tend to brush up against something or grab the wrong thing, and so you're still going to have a high contamination rate. So you should not be palpating. All right. In ICU, we made a little sheet, and I'm going to share this with you, ER folks. So we're going to put it on your Facebook page and hand some of these out in the ER. And basically, it tells you what the supplies are going to be and the steps, and it kind of explains everything. There's a lot of people that are brand new. This is the first time drawing blood cultures, so we understand that, and this is why we want to make it really simple, and everybody should be doing it the same way. If you have been an ER nurse for 10, 15, 20 years, you should be doing the same exact way as a nurse that has been there for a year or less, because if you're doing the same way you were doing it 20 years ago, I guarantee you're not doing it the right way. So everybody should be up to current practice, and that is what we're going to talk about today. There are 2 main things that are proven by evidence in many articles that will bring down your contamination rate. Number 1 is having a pre-made kit with all your supplies. In ICU, we have created these kits. Now, there are some companies that will sell these with everything in there. These kits are proven to bring your contamination rate down. Now, in the ER, it's a little more difficult because you guys do so many of them. The keeping track of a kit like this is very hard, but maybe an individual nurse, you can make a couple of these kits up in the beginning of your shift and just have them ready. That will help you just have everything right there in one place. I used to make 10 IV kits and just have them ready in a very busy ER at the beginning of my shift so that I could just go in and not have to pull things from 10 drawers at the last minute. So in there, let's open it up and see what we have. And this is everything you need, even in situations where you may not be able to do the simple way, which we'll talk about. This sheet is in there, the sheet that I'm going by, right? So there's our sheet with the supply and the instructions. That goes into every kit that we have. You're gonna have some alcohol pads, some ChloraPreps, some 2x2s, the collection device guard, or whatever you call that thing, multiple of these chlorhexidine swabs. Now each one of these kits that we're using is for 2 sets of blood cultures. So as you know, this is one set and this is one set. That means that these two should be drawn from separate sites. And now we get to another thing that we do a lot in the ER, which is, oh, we poked this lady 3 times, we finally got one. Let's go ahead and draw both sets from the same place because I don't want to have to poke her again. You're not doing anybody any favors. Please do not ever get both sets from the same draw. That it doesn't make any sense. It serves no purpose. It causes harm. If you can only get one blood culture set, just stop there. Don't keep poking after 2 or 3 tries. Just get one set, cancel the second set. That is a better practice than getting both sets from one draw. Imagine if you have a contaminated sample and you put it in 2 sets and pretend like they're from 2 different sites. Now you have confirmed that this patient possibly has this bacterial infection because you got it from 2 different sites. So it actually makes things worse. Please don't do that. The other thing you can do is if you can't get enough blood, you can use a pediatric bottle, which you can do 1 to 3 mLs instead of the required 8 to 10 mLs in each one of these bottles. If you have less than 8 to 10 mLs, that also can lead to a higher contamination rate. And you really want to have at least the 8 or the 10, and it seems like a lot, but it's really not on most adults. All right, the rest of the stuff we're going to have some butterfly needles. Again, this is for 2 sets. Your biohazard bag, tourniquet, and these little yellow waste tubes, and a little bit of tape. Okay, so that's everything you should need to draw your blood cultures. Now, the extra things that are not here that you may want to have handy is possibly a 10 cc syringe. The reason for that is sometimes the patient has a hard stick and they're not have the best vein. You might need to hook up a 10 cc syringe directly to your butterfly needle so that you can control the blood that you're drawing out. That will increase your contamination rate, but that's one more thing that you have to connect. However, it's necessary sometimes. So that's the only thing that we don't have in this kit because we really don't use them that often and we don't want to waste a bunch of stuff, but just have a couple of 10 cc syringes handy. All right, so the procedure. We are going to first find our site, and we have Molly here who's going to be our subject. So of course, put your tourniquet on, kind of tight, and tell the patient to squeeze a couple of times, and then feel for your site. Okay. Now I already feel her site right there. There's a couple of things you can do. I just use my fingernail. That might sound gross to some people, but that's what I do. I just push down for about 10 seconds. Firm, but be careful of the old ladies because you just go right through that skin. And now if you can get closer, you can see that there's a mark where that vein is. I also do it in the direction of the vein. So if the vein was going that way, I'm going to place my nail that way. Because this vein is going this way, I made the mark in that direction. Now I know when I go to poke that vein, I'm going to poke right there at the base of that mark, and I'm going to poke in that direction. Okay? The other way that you can do it, and I don't have a syringe here, is actually here. I'm going to take a syringe over here. You can also just grab a syringe, and once you find your vein, put that little syringe right there and just do suction for about 5 seconds. Now you see that dot right there? That's where you're gonna poke. Okay, so those are 2 ways that you can mark your site so you don't have to palpate after. After you do that, you're gonna get all your equipment ready and just tell the patient to relax. You can even take off the tourniquet. And of course, you're gonna have gloves on, which I don't have right now because I don't follow instructions very well. Okay, so hook up your guard. Make sure that you don't touch anything with that. And then pop your caps off of your set that you're about to draw. Take 2 alcohol pads, and this is a really important step. If you just do the cap straight from there, that is not sterile. Right? I know they tell you it is, but that's not sterile. There's air going through there. This is not a sealed environment. So you have to clean them with alcohol before you do that. The other thing that I like to do, because this is a new thing for all of us, okay, is on this little waste tube, you're going to dig in your alcohol and just press it in there so that you clean that, okay, because that is also going to touch your system. And this is just basic microbiology like you guys took in school. Anything that is not sterilized is contaminated, 100%. All right, so now I have my collection device. I have my things prepped. I'm gonna have my gauze ready for when I'm done. I'm gonna have my piece of tape ready over here too, somewhere, I don't know, right there. And I'm gonna go back to draw the culture. So I'm gonna clean with my chlorhexidine, and we're gonna pretend like I'm doing 25 seconds, but back and forth. You don't have to go around this whole entire site, just where you're gonna poke. 4, 5, 25, all right? 25 seconds, and now you're gonna let it dry. It might stay a little bit shiny, but you can tell when that really shiny haze goes away. That's when it's dry. It takes about 10 to 15 seconds to dry. And when it's almost done drying, of course, you're not gonna be talking in front of it like I am. Put your tourniquet back on. Tell the patient to squeeze their hand a couple of times, and I'm not gonna poke you, don't worry. And get ready, okay? Now, in this situation, I'm doing this on the bed. I don't recommend that you put anything on the bed or on the stretcher when you're doing this. You should do it on a bedside table and get close to where you're at, because you're not gonna have an assistant, so you're gonna have to do this all on your own. And basically, you need to be able to reach for everything and control everything with this hand where you've poked. Remember, you're supposed to be wearing gloves. I'm not, because I'm not actually gonna poke her. So you poke your vein in the little spot that you found it, and you're gonna hold it there, okay? You're gonna hold it however you're comfortable. Have one part of your hand on the patient and one on the device. That keeps it from moving. So if the patient moves, you move along with them. And now you're holding that there, and I'm gonna swipe the top of this container. I'm sorry, first we're gonna do the waste, which we already cleaned, and we're gonna put that in that holding device, and you're gonna draw 1 ml. That will get rid of that skin plug that we poked with that needle. Then you're gonna grab your first one, you're gonna put it in there, and you're gonna hold it down and look at the numbers on the side. Each one of those lines is 5 mLs, and you're gonna make sure that it goes up 2 lines. So you have your 10 mLs of blood. Take it out of there and grab your next one. Make sure you wipe the top and just stick it right in there and do your next one. Same thing, watch for the 10 mLs. And once you're done, grab your little gauze, of course, take it out, pop the tourniquet off, and put the tape on, and you're done. So that is the proper collection method. You should not be doing anything other than that. Never a situation where you're gonna draw from an IV that came from the field that they prepped, or from an IV that somebody prepped and now the IV's right there. That is going to get your contaminated sample all the time. So we really need to get to everybody doing it this way so that we can bring their contamination rate down and really decrease the length of stay of these patients and the cost. If you have any questions, post them in the comments, and I'll get to them as soon as I can. Thank you.